people don't put their cameras on, you could turn them off. And went to university in Kingston, and really, love the town of Perth. Several years ago, we worked with people in your community and in Smiths Falls to stop or at least mitigate a whole slew of cuts that were happening at the local hospitals. Successfully to some extent, not as much as we wanted to. Having seen the emergency just roll across the province this summer with the hospitals, even worse than the crisis that we've had for a number of years in our local hospitals, we really felt that we needed to do something. And so we've been trying to work to figure out the best plan to try and protect the local services. And so the reason why we're calling this town hall meeting and why we're holding 13 right now across Ontario, particularly in towns where emergency departments and other services have been under threat or where the emergency and ICUs are just completely overwhelmed, is to try and really advocate to protect those services going forward and to get the government to take action, finally take some action to deal with the crisis that we're seeing in the hospitals. I'm just going to lay some context, and then we have some local speakers. We have John Jackson with us tonight, who works at the Smiths Falls Hospital, Bernie Robinson, who is the president of the Ontario Nurses Association, who has can bring the account from the nurses about what's going on, and John Fennick, who is the past mayor in Perth and former member on the hospital board as well. And then we were going to open up for discussion. So I'm just going to start very quickly with some context. Ontario hospitals have been in crisis for some time, and it really isn't usual. We've grown used to it now, and it almost doesn't even make the news that much. But the truth is, for years leading into the pandemic, we had hospital crises that were not normal in the world, not even normal in Canada. Ontario has pursued a policy of downsizing the hospitals that is really extreme. And it has gone on through successive governments. And so Ontario has led into the pandemic with the fewest hospital beds of any province in the country, fewest hospital beds per person of any province in Canada, by far, by a long shot. We're usually the average, right? Because Ontario has the most population, and it's about a third of the population of the country. So usually what we are is the average of the country. We're the bottom of the country in the number of hospital beds, and the average is 1 bed per 1,000 more than we are. So we have 15 million people. That's 15,000 thousands. We're like 15,000 beds short of the average of the rest of the country. It's significant. And we fund, if anyone, lest you think that what the Ford government is saying, that money wouldn't make a difference, et cetera, we actually fund our hospitals at the lowest rate in the country. Again, by far, it's significant. And of course, money would make a difference. But the problem is that we've had this policy of dehospitalization, of downsizing the public hospitals. Everything that's moved out of public hospitals is privatized. Everything that they moved to home care was hived off. 80% of home care is private for-profit companies. Everything that's moved to long-term care is hived off. The majority of long-term care, 67% of long-term care beds in Ontario are private for-profit companies. And as we see an array of services as they try and open private clinics and so on to take over services, they are private for-profit companies. So there's kind of two things that have gone on. One is constrain public budgets on purpose to downsize. The plan was to downsize the hospitals. The fact that it's gone beyond anywhere else in the country, and in fact, anywhere else in the developed world, of all of the OECD, which is all the quote unquote developed nations on earth, Ontario is third from the bottom in terms of the number of hospital beds, if you can believe it. Like only Chile and Mexico have fewer hospital beds left than we do in the entire OECD. Our European peers have like double the number of hospital beds per person that we have. I'm saying this because I just want to put it in context. Like, these are policy choices. Of course, we can afford to do better. Every other province in the country affords to do better. Every other public health system in the world does better than we do in terms of hospital capacity. It's a political choice not to do it. Yes, it's driven by private interest to some extent and by the desire to constrain public budgets. And so leading into the pandemic, the Liberals, the last couple of years of the Liberal government, they opened up the budget. They, in the crisis that we were in then, started reopening hospital beds. That was sort of 2017, 2018. And then the Ford government got in and brought in real dollar cuts again. So dropped the hospital funding formula so that it was less than the rate of inflation. Sorry, Britt, if there's background noise on anyone's line, can you just mute it? Sorry, I'm unmuting me. So when the Ford government came in, they brought in cuts again. And leading into the pandemic, we had 2 years of really very significant budget constraints and a whole slew of restructuring to public health and cuts to public health and so on. They were trying to restructure EMS, emergency services, EMS, public health, and hospitals and long-term care. And then the pandemic hit. And all around the world now, there is a staffing crisis. We're 3 years into the pandemic and people are worn out, and it's been brutal on the staff. But Ontario really is an outlier. Like, we really do have an extreme situation here. We've never seen this before. From the summer through to the fall, almost 100 emergency department closures across Ontario, temporary emergency department closures, like you've seen in Perth for weeks at a time, where emergency departments are shut down. That has never happened before. It's not normal by any stretch. Closures of ICUs, closures of birthing units and beds and so on, because there aren't enough staff to provide the care in them. It's not because there aren't patients who need the care. It's because there aren't enough staff to provide the care. And in that context, we have wage constraint legislation, like actual legislation to constrain wages for hospital workers, that's nurses, health professionals, and so on in the hospitals, to a 1% increase, less than the rate of inflation, which last time I looked was something like 6%. Which, isn't the reason, but it sure is a fork in the eye of these people who have for 3 years put their lives on the line to protect all of us and to work for all of us, who've worked without vacations, being redeployed, being called in, endless hours of overtime, and so on and so forth. And really, I think the core reason is crushing workloads, just workloads that become impossible. And you could do it for a while, but then if you could possibly retire. Sorry, Britt, can you mute that line?
Eventually your mind will rewire itself.
Thank you. Crushing workloads, like, working in ICUs where you're supposed to have one nurse to one patient because they're that unstable. You have to watch their vital signs all the time. Having 2 to 1 or 3 to 1 respiratory therapists who are called in every minute that they're working 70 hours a week, and then being called in when they're off because their colleagues are sick with COVID or they can't come in because of just ongoing staffing shortages. People, losing every weekend, losing every vacation, at some point it just takes its toll and people vote with their feet, they leave. And that's what we've seen happen. And it is unprecedented. Like, I hope today we can sort of describe in visceral terms what it means for patients waiting on stretchers and emergency departments, trying to get in for care, for canceled surgeries, for people who've waited already a long time for their surgeries. For you, you're surrounded by the large town hospitals in Ottawa, Kingston, Cornwall, that are completely overwhelmed. Now the pediatric hospitals like CHEO, overwhelmed in a way that we have never, ever seen before. And, and yet in Perth, unable to do operations and so on, patients being sent on to other centers that are themselves overwhelmed. This, we're in crisis before the pandemic. There was not an overstatement to say crisis. I don't even have language to describe what's going on right now in the health system. And in the face of it, what is sort of staggering to us, and the reason we're doing this, is that the government is actually doing practically nothing, almost nothing to deal with the crisis. The media is complaining to me that the communications line, every time they do a story about emergency room overloads, they get the same speaking notes from the Minister of Health saying that they're bringing in 6,000 staff. That's been the same thing for the last year or longer, bringing in 6,000 staff, that the status quo is unsustainable and all this stuff. But the fact is that we need about 56,000 staff in long-term care alone. We need about 40,000 in hospitals in order to address the crisis. 6,000 staff just aren't going to do it. And anyway, we're losing more staff than we're gaining at this point because the workloads are impossible. And when you bring in, say, a new PSW in long-term care, and they go in and they see the reality on the ground, they can't do it and they leave within weeks. They're not staying. And so what we need is a significant bump up all at once, kind of like the Quebec government did after the first wave of the pandemic, where they aimed to hire in 10,000 PSWs in long-term care. They paid them for training. They increased their wages. They got them into the homes. They did intensive training for 3 months, got them into the homes in time for the second wave, and had a much better second wave than we did. We had a much worse second wave, and thousands of people died in long-term care in just horrific conditions. So that's for PSWs. For nurses, it takes longer to train, so the only option we really have is to attract back the people who've retired out early, or who have left. And for that, we need to take concrete measures that are going to bring them back. They need some control over their schedules. They need workloads that are possible for them to do. They need to be safe from violence and verbal abuse and so on, which is happening as patients have to wait so long for care. Same with the health professionals, like concrete measures that would get them back, and a big push from the provincial government. The local hospitals could not possibly do it alone. It's all across the province now. And so we need everyone to really pressure the government to do what is necessary to save these services. Our fear is, if you can close an emergency department for weeks at a time or months, then the argument is going to be that it's not needed. And for a long time, they've wanted to rationalize services between Perth and Smiths Falls to reduce, the number of services and how much they have to pay for the hospitals. Our worry is the future of the emergency department, the future of the full service hospital that you have in Perth, and what's going to happen. And, obviously this can't go on. People need the surgeries locally. They need the services locally. There is nowhere else to go. Ottawa has been overwhelmed for years and is even worse now than we've ever seen. And we need some actual action. We need some help. At the same time as they're doing really practically nothing to help the local public hospitals, the government has announced its intention to privatize the hospitals, to privatize the profitable parts of the hospitals, the surgeries and the diagnostic tests that the for-profit companies want to take. So these are the easy surgeries, the high volumes, move the patient in and out quickly, and leave, of course, the heavier, not profitable services for the local public hospitals to do. For towns like Perth, that would be devastating to the local hospital. It would take out the profitable services. It would take staff and funding with it, and further put pressure on the budgets left for public hospitals and the staffing left for public hospitals. So we're also asking people, will you join us to stop them from privatizing the hospital services? I just want to, I'm going to close now, but just by saying we can win. We have saved Local hospital emergency departments across the province. When they tried to close the Wallaceburg Emergency Department, the St. Joe's Island Emergency Department, when they tried to close the Perth and, the Port Colborne and Fort Erie hospitals, when they tried to close birthing in Midland and Leamington, all across Ontario, we have over and over worked with local communities to save those services, and we've succeeded in doing it. When people rise up and they, absolutely say no, we can make that happen. And you have the power to help make that happen in your community. Repeatedly, we have stopped the for-profit privatization of our hospital services. So there's no question that there's hope here. There are solutions, but we need a big push from Ontarians, if every walk of life in every community, to make that happen. And if we don't pour out into the streets over what's happening right now in our local hospitals, what do we do that for? I mean, we have never seen anything like this. I think you're here because you care deeply about this. And we're just asking, will you help to find a solution here to protect those services? Okay, so I'm going to turn it over now to Bernie Robinson. Bernie is a nurse. She's been a nurse for more than 30 years. She's an RN. She is the interim president of the Ontario Nurses Association. She lives in Barry's Bay, and she's worked in emerge, acute care, complex continuing care, dialysis, telemedicine, community healthcare. So she's got the full range of nursing experience over her years. She's also a board member of the Registered Nurses Association of Ontario. And she brings an update from the nurses in the local hospital about what's happening in Perth. Welcome, Bernie.
Thank you very much, Natalie, and to everyone who helped organize this important town hall tonight. So ONA does represent 68,000 nurses and healthcare professionals across the province, and includes also 18,000 nursing students. We are very grateful to be with you all here today and to have an opportunity to share what is happening in our healthcare system now and why we know privatization is not the answer. At this point, anyone who is paying attention has heard this before. Our nurses and healthcare professionals have been stretched beyond the breaking point. We have been in crisis mode for almost 3 years now. At some point, it's not a crisis anymore. It's a new reality, and that is shameful. I think we all know that this cannot be our new reality. We know from the Canadian Health Institute for Health Information data that Ontario is the worst in the country when it comes to RNs per capita. Across Canada, there are 830 RNs per 100,000 people. But in Ontario, we only have 668 RNs per 100,000 people. That means just to be at the Canadian average, Ontario needs to hire 25,000 RNs immediately to reach the national average. So what does a staffing shortage of this magnitude look like in practice? It's become commonplace for nurses to be kept at the hospital for hours after their shift, quite often well into the next shift or even the next shift after that. And it's not possible for them to give safe transfer of patient care. We have nurses working on maternity floors that should have 35 RNs on a shift, but the new normal is to have 17 or 18. We have hospitals where there are more vacant RN positions than there are RNs in staff. So I want to give you a little bit of a local picture, and Natalie has painted a bit of that, but this comes on from very good hands from our nurses that work there. There are many vacant RN and RPM positions on most units, which is creating staffing issues. The obstetrics department at Smith Falls has now been closed for several weeks due to the lack of staffing. And in fact, the ER at the Perth site was closed for 3 weeks previous as well. The hospital has had to turn to agency nurses for the first time, and they now have 8 RNs in the ER and ICU that are agency nurses to keep those doors open. These are specialty units. You need not only educated nurses, but you need nurses who are familiar with the department in these hospitals and how things work there. And each rural hospital is so unique. And the nurses in rural hospitals do far more than our counterparts in the city hospitals, in that they don't have support services like IV teams and, you know, respiratory techs at their fingertip in a lot of rural hospitals. So as resilient and resourceful as our nurses are, we always want to put patients' care first. And even in these difficult times, our members are always trying to find ways to provide care so that they know their patients are well served. But the cost of this burden is taking its toll. We have seen a huge increase in early retirements. Our new graduate nurses are rethinking their careers, and many are leaving after only 1 or 2 years on the job. Some nurses are just leaving to work in the private agencies where they can, you know, ensure that they have some work-life balance. There's a very real cost here to our healthcare system, and this increases as the situation worsens. And now the full picture is coming into view. This Ford government is setting the stage to use this crisis to justify their privatization agenda. Ford took an understaffed system and made it so much worse by introducing Bill 124, which caps the wages of nurses, healthcare professionals, and violates our chartered rights. And Ford is also refusing to work with us as healthcare professionals to invest and implement meaningful retention and recruitment. It leaves our system extremely understaffed, and we don't have any relief in sight. So Ford is using this crisis, which he created, to push his plan to privatize our healthcare. Across the country, as Canadians, we pride ourselves on our world-class universal healthcare system. We believe that access to healthcare should be based on our needs and not on a bank account. Nurses and healthcare workers are strong advocates for the public, for nonprofit healthcare, because we know the devastating impacts of privatization. The most broken parts of our healthcare system are the ones that have been already privatized, like long-term care homes and home care. Private healthcare will take away from the public care by pulling the resources and staff from the public system. As nurses, we've already seen this as our colleagues have left the public system to go and work in private agencies. And honestly, we can't blame them. We can't blame them for making that choice. The agencies let nurses choose their own hours, and they can pay more because, conveniently enough, they are not subject to Bill 124. There's a serious cost here. Those agencies charge outrageous prices to the public hospitals. So they charge what you could staff a hospital with 3 nurses for 1 nurse. They don't provide pensions, benefits, or sick days for their nurses. This undermines nursing as a stable career and undermines our healthcare system by siphoning off precious dollars to line their corporate pockets. This will impact access and quality of care, and it will hurt patients who can't afford to pay for it. Honestly, we cannot let this happen. Ontario's public healthcare system is not Doug Ford's to dismantle and sell off to his corporate buddies. Our healthcare system has been built up over generations, and it belongs to all of us. That's why the Ontario Nursing Association is here tonight with you, and will continue to work hand in hand with our allies to fight for the investments we need in our public healthcare system so that everyone gets the care they need and deserve. Together, we can stop Doug Ford's plans in his track. So let's do it. Thank you.
Thank you, Bernie. Thank you. That was inspiring. So can you just run down just to break it down once more, in Perth itself, the crisis that we're seeing from the nurses, what does it look like? So there are beds that have been closed because they can't staff them?
Yes, the obstetrical department, they do not have enough nurses to work in that department, in that specialized department.
Okay. And then we obviously, everyone knows about the Emerge department closure. You have agency nurses now in Perth that we never had before, right?
Correct.
So
Yes, it
by
is.
agency, we mean the for-profit staffing agencies. These are like
Yes.
profit nurse staffing agencies. And
That's
then are there like are there any other sort of things that sort of define the current, situation in Perth? I just want to make sure that it's clear.
The vacancies, the number of RN and RPN vacancies is really atrocious, actually. It's not, there is nothing to attract them. If you're, and our young graduate nurses, they can make more working for agencies. Why would they come and work in our, in our public hospitals, in our long-term care?
Okay. So for people here, what that looks like is you might be a staff nurse working in emergent or the ICU, right? Where the really big shortages are, or obstetrics. And people are quitting or they're retiring out if they can retire out. And then, so to bring in nurses, they bring in agency nurses. So if you quit, you can go work for an agency. They're recruiting all over, all the health professionals, all the nurses. You get it on your Facebook feed, you get it on your email, etc. All the time they're recruiting you. You choose your own hours. You get double the pay, in some cases up to double or even more the pay. You don't have to work overnights or weekends if you don't want to. And so you may end up working next to a nurse in the Emerge who is an agency nurse making double what you're working. And so it's corrosive. It means more people quit and so on. It's harder to fill shifts. The remaining nurses then have to do more overnights and more weekends and more of the unwanted shifts to cover, etc. And it just becomes this vicious cycle, and that's what we're seeing. Okay, thank you very much, Bernie. I'm going to turn it to John Jackson. John is the local president for the CUPE workers at the hospital. He's worked in the hospital for a long time. He was instrumental years ago. I don't even remember how long ago it was, John, when we were fighting the cuts in the Smiths Falls and the Perth hospital. And we actually stopped a bunch of them, not all of them. Anyway, longtime friend of the Health Coalition. Thank you very much for being here, John. Go ahead.
Thank you very much, Natalie. So like Natalie said, my name is John Jackson. I'm president of CUPE Local 2119 at the hospital. CUPE represents many frontline workers such as RPNs, dietary, housekeeping, maintenance, clerks, amongst many other important classifications. As you are aware, the hospital is seeing concerning temporary closures, including the emergency department at the Perth site, the ICU, and OBS has been closed for months now and is still closed. Lack of staff has been said as the reason. There is a direct link between the current staffing crisis and the fact Ontario is last in Canada in the ratio of staff and beds to population. In the last 30 years, Ontario closed 25,000 acute care hospital beds. Population growth and aging, combined with surge events like a pandemic, make the cracks in the system become more apparent. The closures at our hospital, CHEO pressures, and closures of 80 ERs this summer point to a train wreck and probably deliberate by the provincial government to soften the public to privatization. There's also a growing concern that these cuts will become permanent someday. In our bargaining unit, there are multiple vacancies that aren't filled. Workload for the staff who remain are impossible. Staff are crying and burned out in every department. There's always constant pressure to work extra shifts and overtime. In overtime, there is a heavy, heavy toll on morale. Staff are exhausted, especially after fighting a pandemic. While being called healthcare healthcare heroes, the Ford government passed Bill 124 that limits bargaining wages while inflation climbs. Staff have taken wage cuts of up to 10% against inflation. There is a lot of anger about this. 87% of RPNs CUPE represents indicated they wouldn't leave nursing if they were compensated fairly. At our local hospital, they have resorted to using RPNs from agencies who make up to 3 times what the hardworking loyal staff are making and have their travel and lodging paid for as well. This while regular staff are taking a pay cut. So as we assemble here today, resolve to defend our public hospital system from privatization, you can count on all the frontline workers fighting right alongside you as we push back the privatization plan that the Ford government's implementing. And thank you very much for the opportunity to speak today.
Thank you, John. There was something you said, I couldn't quite make it out. You said in the list of things, you said there was something that has been closed for months now and is still closed. What was that?
The OBS unit has been closed, I believe, since August, and it's still closed. And I think they're calling for it to be closed until well into the new year as well.
Obstetrics? That's what you're saying, right?
Yeah. Yes, and that and there's only one site that has obstetrics in the Perth and Smith Falls area, so that you have to go elsewhere for that service.
Okay. Okay, thank you. Can I just see from the people who are present, how many people here are healthcare workers, like work at the hospital? Do you know how to raise your hands? If you go down to the bottom, reactions, click on the button, and then there's a little raise hand button. Let's just see how many people here work in a hospital or in the hospital locally. Or is it mostly patients and residents? Let's see. Okay, so there's a number of you here. Thanks for being here and thanks for your service for everyone. Okay, thank you. Okay, so with that, I'm going to turn it over to John Fennick, whom you all know. So former mayor of Perth, also was on the hospital board, and I think really took a very principled position, resigned from the hospital board so he could speak and advocate publicly to protect the services there. Thank you for doing that, John. I was telling him just before the meeting, and as he knows, in a number of communities, they've removed the mayors or local councillors from the hospital boards because particularly because the mayors and municipal councillors were advocating against cuts and closures to services and so on, and they didn't want that. And so, you know, for him to do that and to stand up for the community really is a big deal. And I hope you know it's seen and deeply respected. Go ahead, John.
Well, thank you very much for the opportunity to speak. I once considered a career in healthcare, but after listening to some of the speakers tonight, I don't think I'll be heading down that road. When the ER closed, a young single mom with a 6-year-old child came to me and said, you know, my child's got respiratory issues, and you know, I have to go to Ottawa or I have to go to Kingston if something happens, and I don't have a car. So this, while some of my municipal colleague politicians say this is a provincial issue, it absolutely is not. It is a community-based issue that the communities have to get around to try to resolve the issues that everybody's been talking so eloquently about. So I think it's very, very important that your voices are heard. I recently had a meeting with our member of provincial parliament, John Jordan, who's a very good guy. He's very well versed in healthcare, and he's a PA for the health minister. And Carrie Duncan,
parliamentary assistant. Just
parliamentary assistant. And Carrie Duncan, who's director of Lanark Lodge. And Carrie spelled out to John exactly what everybody's been saying here in terms of the pressure points and what's happening. And I want to say, because I want to be balanced here, when nurses, PSWs, RNs are all affected, there's also a ripple effect on management. We're losing senior management, senior directors, because you know they're feeling the pressure as well. And I think that it is important that this community, Perth and Smith Falls, rallies behind what everybody's saying and really catches the ear of Premier Ford and the health minister, because things aren't going to change unless there's some, I think, multiple approaches in dealing with this. I think that you know, we've got a bunch of silos that are sort of built up in the system, and we have to come down and we all have to have a frank discussion about, increasing nursing students, fully paid tuition, opening up residency spots, looking at different ways of care. Agency nurses was a topic today at the inaugural at Lanark County Council. The new head of council there was saying that agency nursing has got to stop because it's so demoralizing having somebody standing beside you where you put your heart, your soul, your career, your family, everybody in front of you to work at a hospital, and somebody parachutes in for money making 3 times as much. It doesn't work. So I think we've got to come together. I think we have to rally, from my perspective, we have to rally my community to say this is a municipal issue. It's just not a provincial issue. We have to bring our member of provincial parliament on side. I think we have to get the Ford government actually listening, not to just one perhaps voice, whether that be the College of Physicians and Surgeons, but open it up to folks like yourself, Natalie, and John, Bernie. You know, there's got to be some frank discussions. And I also believe that in finding a resolution of a crisis of this nature, it is absolutely about give and take. Absolutely, unionized rights and workers' rights are paramount. I've always said we should be thinking about a Bill of Rights for health workers to be enacted that protects them from overtime and not getting time off. But it's also a matter of all parties coming together and giving and taking. So I'm going to continue here. I've been mayor for 16 years and on council for 24, but now that I have some time on my hand, I will continue to advocate for long-term care and for you good folks and finding a solution to the crisis that's before us, because it is interesting how the Ford government defines a crisis. Housing isn't a crisis. It's not a crisis. It's a municipal problem. No, Mr. Ford, it's a crisis. We can't find affordable housing. Healthcare is a crisis right now, and it's got to be called just that. And we've got to get really bright people around the table to find the solution. So I want to thank you all for your service and what you're doing. And I'll continue to do my part to rally my citizens in protecting our Perth and Smith Falls Hospital.
Thank you. Thanks very, very much. Now, there are other people here too who are local politicians or representatives, provincial. Can you just identify yourself? I want to give you a chance to bring greetings and a few words if you'd like as well, and then we'll open it up. I see Reeve Steve Fournier here. Did you want to say a few words, Steve?
Yes, thanks very much. Yeah, I just heard of this recently. I didn't know what this was all about, but some of the statistics I'm hearing are phenomenal. I didn't realize it was this bad. We're a small municipality. We're all the good lands between Perth and Smith Falls, but a lot of our country folk use both of the hospitals as well. Yeah. And within our local municipality, we also have people down in the Ebbs Bay area that use the Carleton Place Hospital. So our little municipality that keeps 30% of all the taxes to run all of our operations, it's hard for us to support 3 local hospitals. So yeah, I believe this is a provincial thing. As John Fennick said, it's a community thing as well. But I think the local politicians need to lobby our provincial representatives and start to get some funding down here. These are amazing statistics of the low shortage of nurses, and the agency thing doesn't work. I don't like that either. So what we can support is get behind you guys and lobby our provincial representatives, and we will certainly do that in the next term.
Thank you. Thanks very much, Steve. Now, Dr. Adil Shanji is here, and he just direct messaged me. There we are. Adil, do you want to say hello and introduce yourself?
Yeah, absolutely. Thank you everyone for such a stimulating conversation. My name is Adil Shamji. I'm a family and emergency physician, but I'm also the member of provincial parliament for Don Valley East. I'm the health critic for the Ontario Liberal Party. And there's so much of what was happening today, of what we have been discussing today, that really resonates with the experience that I'm having in Queen's Park and what I and my colleagues are seeing in emergency departments and what we're seeing from a bird's eye view. And just to very briefly, because I'm not formally invited, so I don't want to go on for too long, but just a few quick things. John, you were talking about how we need to have like a healthcare worker Bill of Rights. Well, the reality is that for many healthcare workers, we have actually the very opposite of that. For example, for physicians, we actually have exclusions from the Ontario Labor Rights Tribunal. So, for example, we don't get protected bereavement time, protected breaks, protected lunches. So we're actually working from a position even further back. But when I think about our healthcare system, I'm actually I'm worried about doctors and people's access to everyone in Ontario having a family doctor. We have to worry about that. But I'm even more worried about our nursing crisis. And we heard from Bernie. Bernie, I wanted to tell you something. I've actually been wanting to reach out to you. I've been really excited to share with you. I'm actually working on a bill to regulate temporary for-profit nursing agencies because it's out of control right now. And it is causing a mass exodus of nurses. That combined with temporary for-profit nursing agencies attracting nurses, and it's very understandable why they would be attracted to that. And then Bill 124 pushing nurses out of our publicly funded healthcare system. And that's a really, really big deal. Earlier in September, we heard that, and this was September data, just over the summer, over 80 ER closures with an accumulated 1,700 hours of emergency department closures. Those are massive periods of time when people called 911 and if they were lucky enough to get an ambulance, they didn't have an emergency department in their community to go to. And that was just in September, obviously, and unfortunately, the situation has gotten much worse. And over the last few months, I've been releasing data that Ontario Health has been producing, but not publishing, not releasing to the public, that shows that August and September were the worst months on record in our healthcare system, going all the way back to 2008. So when I look at this, this is objective empirical data from Ontario Health, which administers our healthcare system for us. It's their own data. And this comes on the back of a consistent, persistent agenda to dismantle and deregulate our healthcare system. And I do believe that it is headed towards privatization. I mean, Doug Ford and Sylvia Jones say the status quo is unacceptable and it has to change. Well, I have a newsflash for everyone. Doug Ford and Sylvia Jones are the status quo. For the last 5 years, they have had an opportunity to improve our healthcare system and respond to things like the pandemic, and they haven't done that. And now they want to take us towards privatization. And I know that the Ontario Health Coalition is working so incredibly hard on fighting that. I really salute you, Natalie. So many things that you're doing, fighting privatization. I was blown away when I saw that you're taking the fight of Bill 7, and making that a constitutional challenge. I couldn't agree with you more, and I wish you the best of success. And you know that we share the same, many of the same goals, and I'm trying to fight against our privatization agenda as well, with my campaign, Patients Not Profits. But I don't want to get into that. I don't want to take up anyone else's time. I just want to say thank you to everyone for attending. Thank you for your interest, and for all of you who are here, Natalie, Bernie, all of the other politicians, union workers, and union leadership, and everyone that's here. Thank you for fighting for the healthcare system, and we have to continue doing that together. And if we can do that and amplify each other's voices, then we will send Doug Ford and Sylvia Jones a message, and Paul Calandra, because it's about long-term care as well. We will send them all a message that we are not going to let our healthcare system get sold out to for-profit corporate shareholder interests. It's about patients first and only. Anyways, thank you very much for having me. Good luck with that.
Thank you, Dr. Shamji. Thanks for being here. Thanks for the kind words. And thanks also, we recognize the healthcare workers, but the patients as well, all of you here, and families. Brian, you had your hand up. Are you also a municipal, sorry for my ignorance here. Are you also a municipal representative? Sorry.
Thank you very much, Natalie. Much like Mr. Fennick, I spent 20 years, I just retired as well. Where I was the leader of a municipality outside of Perth. And what I would say is that Mr. Fennick's correct in the municipality needs to do more, but we have been working with both Perth and Smith Falls Hospital for a number of years to help them out with their capital projects. And that's what we understand was the community's responsibility. The province's responsibility was to operate the hospital. They did a terrible job. A number of years ago, the province downloaded a number of responsibilities to municipalities and roads, bridges, OPP. And at that time, the province said, we'll look after healthcare and we'll look after the ambulance. They haven't looked after either one of them. They did a terrible job of it. My wife worked at the hospital in Perth for 35 years. And a number of years ago, shortly after Lynn's come in, she come home one day and she said to me, oh, I had a high-priced consultant, and this lady told her what she made, come in and sit down beside her one day and ask her questions all day long to try and save money, to try and downsize. And I believe that that was the start right back then, whenever this happened. And it's just gone downhill ever since. And both our hospitals in Perth and Smith Falls are great, and everybody supports them. And I applaud you and I applaud Bernie for the work. And I think the Perth community, as well as the Smith Falls community, will do whatever we can to keep both of these hospitals open with adequate staffing. Thank you very much.
Thank you. I should just mention quickly, Ross Sutherland, who is a municipal councillor for South Frontenac. Many of you know him. He's done lots of work in the community. He's our co-chair. He's a retired registered nurse. He wanted me to send his regrets because we're doing a meeting like this for Chesley, Ontario, where their Emerge continues to be closed and has been closed for a long time. At the same time, he's on that one. So he asked me just to send his greetings. And the other thing is that Dr. Alan Drummond, he asked him if he could speak tonight. He couldn't because he's driving back from Toronto. So also regrets from him. But we're, everyone is together on this, trying to fight this. So, and I also should say, we're saying all of this, like we're just laying it out for you, right? We're not partisan. We don't tell people how to vote. And that's not the purpose of this anyway. The governments understand political pressure. They understand pressure. When people rise up in large numbers and they pour the pressure on them, things actually change. That has happened with the Ford government over and over. Like, we're not here about the next election. We're here to actually protect the services in your hospital. I'm worried because once you close an emergency department for weeks and weeks, once you close obstetrics, etc., then the argument will be that you don't need them, that you can go without them. And without an emerge department, a hospital isn't a hospital. That's it. And don't let anyone say to you, because this may come about, that they'll replace it with an urgent care center. That's what they did in Perth and in Port Colborne and Fort Erie. There is no such thing as an urgent care center, not in legislation, not anywhere. That is a glorified walk-in clinic. It's not an emergency department. Ambulances don't go there. The H comes down off the hospital. You don't have then the range of inpatient services because you can't have them. And it no longer is a hospital. So, for us, we want to save the range of services, a full service hospital in Perth and Smith Falls, both of them. That means that the surgeries need to be able to be done there. It means that you need enough staffing to run the obstetrics department. It means that you need to have enough staffing for an ICU, for an emerge, etc. And that is a minimum. And without that, everyone in the community should be out in the streets with pitchforks, most communities in Ontario spent the last 100 years fundraising, donating from your payroll, volunteering, literally building up the local hospitals to have those services. We, as Bernie said, they're ours. We cannot let them dismantle them. And once they're gone, we've done this. It's so hard nowadays in these times to win new services back, like to get them reopened. So let's just not let them go there. So I'm going to open it up for questions and answers and then talk about what we can do. So first, questions and answers. How should we do it? And for a deal, I don't know if you can say on Brian, John, Steve as well, if you don't mind. People, please direct your questions to whoever you want to direct your questions to. I want to have an open discussion and let's figure out the best thing that we can do to mount the most pressure possible to make sure that concrete urgent actions, you know, reflective of the actual crisis that we're facing, happen. So now, can you use the reactions button? Is everyone okay with this? Can you, because I can't see all three, there's 70 people here. I can't see all of the screens. So if you move your cursor down to the bottom of your screen, if the toolbar isn't showing, it will show. And towards the right, you'll see a little smiley face with a plus and it says reactions. If you click on that, the bottom one says raise hand, and you can click raise hand. If you want to make a comment or ask a question, please go ahead. So if you can hit just to raise your hand if you want to say anything, don't be shy. I'll start, there's some in the chat, I think. Sorry, it's hard to manage both at the same time. Okay, there's things about, like, I thought CUPE was representing RPNs. I'm not sure if that's sort of really all that relevant, but does CUPE, I don't know, does CUPE represent RPNs? John? Or Barney?
15,000 across the province under OCHU.
Okay.
At the
So,
Perth
yes.
Smith Falls Hospital, CUPE represents RPNs.
Yes, ONA does have RPNs in some of our bargaining units across the province. But a majority, I believe, of the RPNs are with the CUPE and OPSU unions, as far as I know.
Okay. Someone asked, is this because of the Ontario debt? Well, no, I mean, Ontario funds, like, Ontario chooses what it does for taxes and what it does for expenditures, right? Money in, money out. Ontario for decades now has chosen to cut corporate taxes, and taxes mainly, obviously tax cuts almost always benefit the wealthy, right? Because they're the ones that pay the most taxes. So, you know, has chosen repeatedly to make tax cuts, mostly that benefit the wealthy, and corporate tax cuts, and make commensurate cuts to services. And so Ontario now funds our public services, all of them, at the lowest rate in Canada. And, you know, we fund hospitals at the lowest rate in Canada. We fund our healthcare at, you know, usually like the bottom three of provinces in the country, depending on how you measure. So this isn't really about like, we can't afford it or anything like that. You know, we're like one of the wealthiest countries in the world, and one of the, you know, when Canada was its richest, I think 2 years ago in our history, and we're still up there, by the way, it's not like we've plummeted or anything. You know, so we built public health care when we were far less wealthy as a nation. This is a question of political choices, not of actual affordability. Any other questions, or people are being shy and putting them in the chat? Anne, go ahead. Oh, can we unmute Anne? Do we have to ask her? Sorry, Britt is doing this from our staff.
I've asked her to unmute.
Okay, go ahead and unmute yourself, Anne. She's probably trying to unmute. Okay, keep trying to unmute. Is there anyone else that has I don't know what to do. Britt, do you know how to unmute Anne? I don't think she's being able to unmute there. Can we unmute everyone?
Yeah, I can do that.
Let's
quickly.
try that.
Oh no.
It's not working?
You have to ask people to unmute.
Okay.
Yeah.
And can
There
you
we go.
put it in the
Anne's there.
chat? I'm sorry.
Yeah, there's also a question in the chat.
Oh, what is it, Bev?
It's someone is saying, could we have a little more information on this issue around what agency nurses are? Let me just quote it to be exact. Oh, no, there's so many chats coming in here.
I know it's hard to
Obviously-
follow, Sorry.
Yeah, it's.
Hi there.
Great.
I'm sorry to interrupt.
Great.
I'm looking at that one there. It says, can you explain in a nutshell what the situation is with agency nurses? I have not heard about this until tonight. That's the question from, looks
Okay,
like
Bert.
Green.
Thank you, Don. Bernie, do you want to take that one?
Sure. So corporations have traditionally had agency nurses but not in the volume that we are seeing them now. They are now getting funded or charging hospitals 3 to 4 times what a nurse makes to put a nurse in there, and they
So
are
let me step
able
back
to
just
get it.
one sec. So like, you know, like temp agencies,
Yes,
you know, it's the same thing, but for nurses. So they're like temp
yes,
staffing agencies, but they're for profit and they are for nurses, but they're also for health professionals.
that's right.
Yeah,
And they've been around forever, because I will tell you, when I graduated in 1984, there were no nursing jobs. And I had to go to a temp agency. I was only there for 3 weeks before I got my job in Barry's Bay, and I moved there permanently. But they've been around a long time.
but they were sort of like you didn't have hospital staffing emerge and ICU and stuff like
Yes,
that.
I
right?
actually, my first job as a staff of that agency was to go to East General Hospital and work there as the new grad with no orientation and nothing.
Okay, but now, like, I think what we're trying to explain is the difference now is we've never seen this kind of level of private for-profit agency nurses being used to staff the hospitals and so on, and even long-term.
No, and being blatantly used. It's an on-purpose move by the government. They know that this is the only option hospitals have. They have to staff, they have to have enough people there to keep their patients safe. And so they're putting the money out to them.
Yeah. Okay, I hope that clears it up for people. So when you go, like I was talking with a laboratory technologist, so it's nurses, it's also health professionals, and they are getting endless recruitment drive stuff on their social media, like their Facebook and their Twitter and Instagram and all that stuff from these companies. And they're offering exorbitant sums of money to work anywhere in Canada, even in the United States and so on. They'll pay your relocation and so on. You choose your hours, all of that stuff. And that's what, you know, that's what they're doing, because there's this big demand and people are paying sky high prices for them. And so that's why you end up with a nurse like working in Emerge, who's a staff nurse who stayed with the hospital, even though all of them have the choice to leave and do that. But beside her will be a nurse who's from an agency being paid, you know, double, triple what she's being paid, and only has to work the shifts that she chooses. In the past, it was not necessarily attractive because they don't have pensions and benefits and so on. But now the pay is extremely high. And the workload is different. You don't have the, you know, crushing, endless, you know, overtime and all of that stuff. And that's why you're seeing this kind of vicious cycle of they're cannibalizing the staff in the hospitals and in the long-term care homes. Okay, I'm going to turn it to Sarah. Anderson has a question. Go ahead, Sarah. Do we have to ask you to unmute? Sorry. There you go.
I got it. Thanks. Hi, I'm Sarah Anderson. I'm a X-ray tech at the Renfrew Victoria Hospital, and I'm the local QP president there. I was just wondering, Natalie, what are the next steps? What can we do, and what's the plan of action that we need to start taking?
Okay, great. I'll take the questions and then come back to that. But
Thank
we'll
you.
move to it very, very quickly. Okay, thanks, Sarah. And thanks for being here from Renfrew.
Thank you.
Okay,
for
and
having
Jen.
me.
Hi there. Sorry, a bit camera shy here, so I hope it's okay. I'll just leave it like this.
Totally.
Okay. I'm in the community, a patient, I guess you could say, and had some pretty horrific experiences due to healthcare shortages in recent years. So I've become involved again, just to advocate and hopefully have others avert some of the horror stories that we experienced. So one thing, I mean, it kind of stems from what Sarah just mentioned, but I just wanted to share that the thing that's most frustrating for me as someone who's out there, you know, trying to advocate is to combat the mixed messaging. And so and again, I know everyone who's involved in this is, you know, being pulled in a million directions and there's only so much one can do, but I I do think, just I wanted to share from my perspective, if there could be a way to more clearly combat the misinformation that's coming from the government with respect to this not being a crisis, I think that would be really effective. And even I'm talking, you know, things that are easily shared on social media, because that, of course, is just such a huge medium that people, you know, when we talk about staffing levels, it would be wonderful. And if I can be so bold as to just make 2 quick suggestions, and then I just wanted to be sure to share this, because this has been my biggest frustration point. I don't know how to share this information to combat some of the misinformation out there. It would be wonderful to have something that would keep a finger on the pulse of the shortages. So, you know, when you're talking about, you know, how many nurses are required at a particular hospital to be fully staffed across province, and even if we could get so bold as, you know, by community, and where are they at now? Just to be able to, you know, easily express where these that this is a crisis. And I just find it so hard to express that when you're not living in it or working in it. So I just really wanted to share that. I find I just have these moments of, I don't know how to share that what these claims are absolutely false. And so any assistance with that would be tremendous for those, you know, those of us who are sort of in the background here trying to correct what's being put out there at the moment.
Okay,
So
yeah,
thank you.
that's a great idea. Thanks, Jen. So like really like in a nutshell, very simple, clear messages about how this is an unprecedented crisis. We've never seen anything like this before, and we need like some urgency, some actual action on the part of the province to help, right? That's what you're saying?
Yeah, in essence, because I just feel for those of us who know, we inherently know there's a problem, and yet we're constantly inundated with this messaging from the Minister of Health stating it's not a crisis. These investments are being made. So just, I think for all of us who are passionate about correcting that misinformation, it would be so wonderful to have a place to go that we could really quickly share. Here it is. This is it, like right now. It's real. Yeah.
Got it. Okay, good. Okay, so people are asking for the action plan, and so I'm not going to carry on for too long, but I'm going to suggest a few things. Jennifer, go ahead first, and then we'll do that.
So I'm in Sudbury, actually. You guys aren't coming here, so I jumped on the next train, which was tonight. But my MPP is the NDP critic for healthcare, France Delina. So she's been around for a long time. And I actually talked to her office about something else today. And I just want to echo Jen W's point that I also had a negative, like an incredible experience of systems not working. And what I get is they listen and they say, we can't help you. We can't help you. And I find that constituency offices are understaffed. People are not experts in everything. And I know that there are a lot of citizens who have your professional job and your various roles and your experience. But I'm also feeling that actually also in the matter of digital stuff and TikTok and social media as well, I have some serious concerns. But who do you call? You can only post on LinkedIn, or you can only, share on Facebook so many times. There is, I believe, a need for what Jen W said. There's a lot of systemic blocks, and I don't think it's accidental. And I wanted to suggest that maybe all of these groups that you're having could meet more regularly, so people get to know each other, share information, and kind of like redo the kitchen table meetings on Zoom, but not just once in a while, but as a regular thing.
Yeah. Okay. Yeah. Thanks, Jennifer, for sure. So we, one of the things that I would like to do is is there a local citizens committee that's working to try and, save the hospital services and protect a hospital? Just, is there anything already existing of that sort in Perth right now?
No, there's no organized community group specific for that. I mean, we have our foundations who are working very hard for the hospitals. As Steve Fournier said, our municipal governments are contributing money to capital campaigns, but we don't have any organized group in Perth and Smith Falls that I know of that is addressing this on a regular basis. And just to some of the other speakers, I think it's a great idea to perhaps organize something like that. In order to keep the fire to the feet of John Jordan, who's a friend of mine, and keep this on the forefront. So I think it's a great idea to meet on a regular basis, and certainly I'd be happy to look into maybe organizing something from Perth grassroots to coordinate information and bring these issues forward. I'd be happy.
Yeah, I think we need it. Like, we have local health coalitions across the province, and that's what they do. And also for patients, so if people are, struggling and not able to get home care, not able to get, hospital care and so on, and there are some actual solutions, then they can work with the local health coalition. Often we have nurses and physicians and others on the coalitions that can help, and or we can from the Ontario office as well. So would there be people who would be willing to help form a Perth Health Coalition to immediately to help advocate to protect the hospital services, to deal with the crisis that we're in right now, but also to, do that. Basically, we could meet by Zoom, so people don't have to go out in the middle of the pandemic and so on, but share information. And then also, I think we should send a delegation to see John Jordan from this meeting to really push him to bring it to the legislature and really put pressure on his own government to address these problems. I mean, you're talking about like obstetrics and emergency and really vital care in the community. I think that needs to be pushed, right? So are there people, can I just see from in the chat or a show of hands, are there people who'd be willing to volunteer to be part of that? You don't have to be specially knowledgeable, and it's not an overwhelming commitment or anything, but okay, so I see Jennifer, Gary, David, Brian, John, Anne, Terry, Britt, can you get these names? Sorry, I'm taking a screenshot.
I'm taking them down. Don't worry.
Okay.
I think
And
if I could, Natalie, if I could, Steve Fournier's hand was up. He's currently an elected official. He would be great to have along, and I think he's willing to help out.
Thank you. Sorry, I missed that one. That's great. Thank you. Okay, so after that, Vivian, your hand is up too. Kathy? Sorry, I'm just making sure Britt gets them. Anyone else that I missed there? Okay, and we'll invite all of you. Like, we'll send an email to everyone and invite you, but like, it's open, right? We like the way that we work, everyone is invited if you are willing to help. And obviously if you're against it, this isn't a debating society. We're trying to actually do something here. So so what we'll do is we'll send out an email in the next day or two and get a meeting together and move forward. I think the first thing we could do is a delegation to see John Jordan, right? And let's push him. Let's push them together. And let's say we had, 70 plus people here in Perth who are concerned about this, who want, concrete commitments. And let's push for concrete commitments. I would like to see a motion in the legislature, of some sort, committing to keeping the Perth Emergency Department open and a full service hospital, to getting the obstetrics reopened and maintaining full services. And then, the list of things that we're calling for collectively to address the staffing crisis to be addressed, right? That I think is key. And then we also want to push them to stop the privatization across Ontario. So the other thing is that people need to know that there's a fight. They need to know that there's a crisis, that it is urgent. It's become so kind of normalized that there's a crisis in the hospitals that people are just, don't necessarily realize the extent. I think Jen was sort of saying this, that it's a problem. We just met with about 100 and something people in Ottawa last night. Before the winter holiday, we wanted to do something really visible. We wanted to thank the hospital workers and the hospital leadership for everything they're doing, everything they've sacrificed, everything they've done, and push the Ford government to give them the support that they need and stop privatizing their services, kind of that message. In Ottawa, they agreed to hold an event on December the 9th, it's a Friday, outside the Civic and CHEO, the Children's Hospital of Eastern Ontario. It's at there's a little park across the street and there's a fence, and we thought we could bring flowers and candles and messages of support for the hospitals, and put them on the fence. And then also messages, pushing the Ford government to actually support the hospitals for real and stop the privatization. I wondered if you wanted to join in, like if we could carpool or something like that up to Ottawa, or if you wanted to do something in Perth, or like leave a bunch of messages outside the Perth hospital and then carpool up to Ottawa. I don't know. I just wanted to get feedback on that and see. I mean, we want to have a show of strength at this point. We don't want to have like 20 people, outside a hospital. That's not going to do it. We need them to see a big message. So what do you think? Is this something that people would want to do there? Would you want to do it in Perth? Would you want to, do something in carpool up or go up to Ottawa? I just wanted to get your feedback. Now, some people have their hands up, but I think it's because you were volunteering. Or can you put your hand down? You can go into the reactions and put it down if you were volunteering. But if you want to respond to that. So Anne and Lucy, Anne, are you able to unmute? You're in like Zoom hell over there, Zoom purgatory. Okay, Lucy, go ahead. Oh, no.
Yes. Hello. Can you hear me?
Yes.
Okay, great. This isn't a response to your question about showing, having a show of force at CHIO. So I'm just going to set that aside for if that's okay with you.
Yeah, go ahead. Sorry.
Okay, so my suggestion is that the story is not being told, and the story is not being told in a way that people can relate to. When the story is being told, statistics are great and they're important because we need to have data to make our case. So my suggestion would be to try to identify 1 or 2 or 3 journalists / reporters in the province of Ontario. Locally would be even, better in some ways, but also to have a province-wide scope. Who's interested in this? I mean, this is an important story to be told about what's happening to our healthcare system. And if we were able to identify some reporters or journalists for whom, so in the province of Quebec, they have Andre Picard, who writes nationally about health. He would be a wonderful asset, and that would regularly report on the condition of what's happening in healthcare and put a human face on it. The story of the single mom not being able to take her child who's got respiratory problems to her local hospital, and she needs to go to Ottawa or Kingston or Brockville, and she doesn't have a car. Like, who can't relate to that? Right.
Yeah.
So anyways, that's all. I don't want to belabor it.
It's a great idea. I was thinking, CBC, maybe what we could do is ask them, like, I wish they were here and could hear the descriptions of what's going on in your local hospital, and do that sort of in a number of towns and then tell the story. So maybe I'll ask some of them and see if we can, convene a meeting and do that with them. And for sure, I think that's a great idea.
I mean, it's something that needs to be nurtured over time, right? You don't want it to be a one of, you want them to be involved and have, in the story as they're writing it and developing over time.
And follow it.
Until we get what we need.
Okay, thank you.
Okay.
Great idea. Now for the action, let me just go back to the action and get a sort of a conclusion on that and move on to other ideas. And you still have your hand up. I'm feeling so bad. I don't know if we can hear from you. I'm not sure what to do. Your mute is just not coming off. Okay, Gary? Can Gary unmute? Britt, are you asking? Oh, there we are.
Just unmuted.
Thank you.
Can you hear me?
We can.
Good. I'm a retired surgeon, quite a long time retired. I've worked in Britain, the United States, Canada, and Trinidad. And I want you to know, and I've been a patient in many hospitals many times. I've had at least 13 major surgeries. So I do know a little of what I'm saying. The Perth Hospital, where I've had 2 major surgeries, is the equal of any. It doesn't do everything, but what it does, it, at least in the past, has done exceptionally well. And so it's important for people to know what it is we're defending. We're defending an excellent hospital that's worth everybody's effort. And, you know, we shouldn't forget that. That's what we're doing.
Thank you. Thanks very much.
You're welcome.
I wish we could broadcast that, you know, don't you? We will. Why don't we do that, Gary?
Sure.
Okay, so the action, very concretely, who by a show of physical hands then would be willing to join in if in Ottawa, or yeah, let's start with that. If we were to do it there, would people carpool there, or people would be willing? Some people, I'm seeing some people's hands up. Okay. And if, do you want to do something there? Like, I feel like we should at least leave, you know, messages of support and so on outside the Perth hospital, the beautiful Perth hospital, you know, before en route or something like that, right? Okay, so when we meet, maybe we can solidify that. Okay, and then there's a bunch of Terry and then Linda, and I see Anne sort of went out and came back into the meeting. Hopefully she's now able to unmute. So Anne, if you're here, speak up and we'll put you on. Oh,
am I speaking? Can you hear me?
There you are, yay.
Yeah, no, I sent a couple of messages just asking John Fennick to organize a meeting here, because that's what we need. I have thought that in the past, as the last gentleman said, we've been so lucky with the Perth Hospital and with Lanark Lodge that it hasn't, we haven't been called to really action about it. But obviously, with everything happening here and in the province, it is time for us, our small and up till recently very happy community, to start taking some action. Yeah.
Oh, awesome. Yeah. Okay. Thanks, Anne. Okay, and don't forget the Smiths Falls site. Absolutely not. So
Yeah.
we would do both, right? Smiths Falls
Yeah.
to Perth to Ottawa. Makes
Well, they're
sense?
completely dependent on each other. Yeah.
Yeah, yeah. Okay, and Bernie, go ahead.
Yeah, I just want to say that it is so vitally important that we maintain our small community hospitals. Our communities all need them. They're home to many people, so they don't have to be in, you know, hours and hours away. And we need to keep their doors open. We need those services and we need them at home. And this is the only way to get them, is to fight for them.
Thank you. Thanks, Bernie. Okay, on the sort of overall thing, we're asking, this is something everyone can do, and it's just easy. We're asking if people will we're trying to get 1 million public Medicare defenders to fight the privatization of the hospitals. We think we can, there's 15 million people in Ontario. 1 million people would shake up any government. That would shake anyone. And so it's super easy. I'm going to share my screen quickly. This is our website, just looks like this. So if you go to Ontario Health Coalition in Google, this comes up, or it's just ontariohealthcoalition.ca. That's our website. And this is what it looks like. By the way, I'll show you where the stats are if you need them. So this is kind of a slideshow that goes across the top here. And this one says, become a public Medicare defender, and you can click here to get into it, but it's also right here, defend our public health care. And so we're asking people to sign up. We're not going to share anyone's contact info or anything, but there's kind of a ticker across the bottom that counts how many people have signed up, and it says just the first name and where the person is. So you don't have to identify other than your first name, We're counting. We're going to get to we will get to 1 million. And then we'll be able to say there are 1 million people who are signing up to stop the privatization of our public health care services. And all that means is that if you can, hand out leaflets in the community telling people what's going on. They're on the website here. You can just click and get them. We're asking people to fill in surveys because one of the things we know, and actually, Anne, I think you did an article in the Canadian Medical Association Journal or something on this. The for-profit clinics, these are like the eye surgery clinics and the MRI, CT clinics, the diagnostic clinics and so on. They have actually started to move in. We don't have a lot in Ontario. By and large, the vast majority of surgeries and diagnostics and services are done in our public hospitals, but they have started eating around the edges. And where they exist, they are charging patients all kinds of fees. Like you probably have this experience. If you've gone for cataract surgery, they'll charge people an extra $200 for eye measurements that are medically unnecessary, but they don't tell people that. The OHIP covered eye measurement is all you need. But if you have 1,000 patients and you charge $200 for each of them, that's $200,000 a year, right? Extra income. They're charging for the cataract surgery. They're commingling it with, lens upgrades and all this stuff for your eyes in order to charge for it. And the prices are outrageous, $2,000 an eye. I just heard from one of our local coalitions, one of their members was charged $7,000 an eye for their cataract surgery that they had commingled in these lenses with. OHIP pays those ophthalmologists $550, I think $557 for the surgery. It's a 7-minute surgery, which is plenty, way more than enough for that surgery. For them to be charging $2,000, $1,200, $7,000 for cataract surgery is ludicrous. And mostly they're billing OHIP as well. So one, it's illegal. You cannot charge a patient for a medically necessary hospital or physician service, but the private clinics violate the Canada Health Act and they do it all the time. We've called every private clinic in the country multiple times. We said, I'm a patient, I need a shoulder surgery, I want to pay to jump the queue. How much do I have to pay to get my surgery fast? And they'll say, for shoulder surgery, it's 10 times the cost in the public system. Hip and knee surgery and so on. It's a violation of the cornerstone tenet of public health care, that it's there for us based on need. We pay ahead of time through our taxes. We've already paid for it. No one should ever be charged for those services. It's outrageous. And mostly it's to the elderly who can't afford to pay. That kind of privatization is a threat to the future of Medicare in Canada. And that's why we oppose the for-profit privatization of the hospitals, among other reasons. So we have these surveys because are there people here who've been charged for cataract surgeries or those sorts of things in private clinics? I'm sure there are. So we're asking people, will you pass out the surveys? Especially among seniors organizations or other community groups and so on. They're here on our website. You just click and you get the survey and get people to fill them in. What we're doing is collecting the evidence, the stories of people who are paying. We're finding out what the current prices are. They've gone sky high in the pandemic. We can file a writ of mandamus, which is a legal action to force the government to uphold its own laws. We have Medicare, we have laws protecting public health care, protecting patients against user fees, the Canada Health Act, and the Protection of the Future of Medicare Act in Ontario. And so we can push our governments to actually protect public health care by doing that. So the second thing that the Medicare defenders were asking you to do is to fill in the surveys yourself or share them around to people that might have had those experiences, and then also promoting and attending the local protests and actions. So that's what it is. And we're asking anyone can do it. You could do it tonight. It'll take 5 minutes, less than that, a minute, to become a Medicare defender, and then ask others as well. And, we hope to get to 1 million Medicare defenders. And that's the big fight back against the privatization. Does anyone have any other ideas? So in the immediate future, we need to create a local committee. We need to go meet with the local MPP, put some pressure on him, put messages of support outside the 2 local hospitals in Perth Perth and Smiths Falls, and then join in hopefully the action in Ottawa on December the 9th. And then, try and get these surveys filled in and sign up 1 million Medicare defenders so that we push back against the privatization. And then we can move forward from there. That's what we were thinking. Then in addition, your suggestions were try and contact some media that will tell this story in depth and follow the story and really help us advocate to protect these really vital local healthcare services. I'm thinking CBC would be good because it's kind of everywhere. And print media is doesn't quite reach everywhere in the same way it used to. So if people are good for that, we can work on that and then call another meeting and have them join and listen and go from there. And then people ask for some really good bite-sized kind of materials that could be shared with the vital information that really lays out the crisis, right? So that's what I took. Is there anything else that I missed or that people want to see or think might make a difference? I think we have a good start, to be honest. Okay, I feel really good. I hope you feel good about this. I feel hopeful here. Jen, go ahead.
Sorry, one final thought. The one other thing that I was thinking as all this is unfolding, and this is an investment and I don't know where it would happen, but I think we have all learned that we have short memories. So although we're compiling this information of what's going on right now, I think it would be a really interesting project with the hopes of a happy ending of documenting some of the chaos that's unfolding right now. I think that puts the government on notice that this is being compiled as a record of what is transpiring. That is something that I think, again, we live in this world where things come and go so quickly and it's information overload, but if there's any way to compile, for a lack of a better word, again, the chaos that's kind of unfolding when we have these bills getting thrown at us and what's being said in Parliament, I know, or in the legislature. I know there was I think it was the PA that got up the other day and used air quotes for privatization. These are things that while it's happening, while it's unfolding, and while hopefully we have gains, can be recorded as well, because I just think it's a really pivotal time. I really do. And it could be used for something in the future.
I love that. I had this idea, I don't know if it fits, but I was thinking about Oxfam or some group like that to go into the hospitals together and pull together a report documenting what's going on as the humanitarian crisis that it is, it's kind of different, and it would be I don't know if that fits. Does that fit kind of with what you're saying?
I think we're missing a piece. It almost speaks to the idea where it's not all stats, and I appreciate that. And it's not all, these speeches in the legislature.
Yeah.
It is about the real life impact, but I think it's all. So if there's a way to intertwine it, that I think would be really incredible. And, we have this now with Bill 7, will it be implemented? And it seems people are very willing when and if it is implemented to share their story. These are things that I think have power in being compiled. And again, also speaking to, I think it was Gary's point there, compiling stories of how important these hospitals are to our communities. So I just think if there's a way, we're just, again, the quick bites are what I was asking for, and I think we really need them because we do need to combat some of this misinformation that's out there. But I think at the same time, there's so much happening, it feels a bit chaotic, that I think there could be a lot of impact in pulling that story together and that picture together.
Thank you. Okay, we'll definitely, let's do that. Now, Britt, I'm just asking everyone who's here, we have your email address, right? Because you're here, you had to register. Did we get phone numbers?
I believe it was on the registration list, but I'm not
okay,
sure.
Good. So we're able to phone people then. So as we move forward, we'll invite everyone to a local planning meeting. Gary nominated you, John, to convene. Can I bug you about that over the next 24 hours?
Yeah, I'd like to thank my friend, Dr. Gary Cornell, for the nomination. And I will accept. Just when I think I've got a lot of time on my hands, things conspire against best laid plans. But I'd be happy. We'll talk later, and
Okay.
I'd be happy to do something here. I know John and I were talking about having a real live town hall, and inviting everybody to come and just saying, folks, Smith Falls and Perth townspeople, come on into this building because we got a story to tell you, and this is what we
Okay.
need. But anyways, we can talk about that, and we'll coordinate that, and I'm happy to help out.
Wonderful. Okay, thank you so much. So then we'll get back in touch with everyone. Oh, go ahead, Britt. Sorry.
All right, just before we take off, I know some people are visual learners and then some people prefer to read or hear different things. So just go to our website, ontariohealthcoalition.ca. There's tons of statistics. Different members of the group have been compiling it. So there's a lot of other information.
Yeah, if you're looking for like those hospital stats and stuff, they're here under the health system facts and trends. You can get the, the beds and all that stuff I was telling you and so on. But I mean, the human stories are also vital too. Thank you so much, everyone. So it's 8:36. We won't sort of take advantage of your time. Britt, can you save the chat? Because then we can read through it and make sure we didn't miss anything. Thank you all very, very much. I think I'm feeling really hopeful and inspired. The ideas were great. And thank you for forming a local group because that's what's going to make the difference here. So thank you. Thanks very much. Yay. Sorry for the bad news. Happy Tuesday night, everyone. Take care.
Bye, everybody.
Bye. See ya. Okay.